So Transform is one of the UK's leading providers of cosmetic interventions. We provide both surgical and non-surgical treatments to patients across the UK via our 3 state-of-the-art hospitals and clinic network. We work with world-class surgeons and practitioners who deliver fantastic care to around 12,000 patients per year. We have a very patient-centred approach. We work really hard to understand our patients' wants and needs so we can deliver to them the highest quality of patient care. The non-surgical space is alarmingly under-regulated in stark comparison to the strict regulations that are currently in place for surgical cosmetic interventions. Our partnership with the JCCP is as a result of the work that we've been doing with industry stakeholders and government to ensure the safety of our patients who are undertaking non-surgical procedures. We've been in discussions with the JCCP for some time now, and during those discussions it's become quite clear that we're quite aligned in our thoughts in providing patients with much more information about the non-surgical treatments that they're about to undertake. It's really important that the patients feel as though they're able to access that information so they can make informed decisions about the treatments they're about to have. The JCCP will provide a much needed marker of quality for practitioners delivering non-surgical treatments so that patients can have confidence in the quality and standards of the treatments they are going to receive. We are absolutely delighted to be the first provider to join the JCCP register. We really hope that other providers will join us so we can form a coalition of responsible providers, and together we can work towards driving up the standards within the industry.
The JCCP is all about its standards, ensuring the standards are put in place, assessing the regularity of the checks that we put in place. So again, our standards relate to premises, to practitioners, their competence. But imagine now we're looking at our provider organisations. Now the JCCP doesn't provide a kite mark of quality to a clinic by name. It provides a kite mark of quality to a clinic because the practitioners who work in that clinic have been demonstrated as meeting the standards. So by default, the clinic will display and should display the JCCP logo. Its aim was to identify what constitutes safe practice and public protection. And do you know there are 2 parts to that? Maybe even 3. The first is ensuring that no harm is caused to an individual seeking a specific non-surgical or hair restoration treatment. The second is that we've made sure as best we can that individuals know what to expect and that there is no psychological or emotional harm caused that could be avoided. And the third is to ensure that the people who deliver the cosmetic interventions and procedures are experienced, well-trained, confident and proficient to deliver that service. Are we really informing the public of the risks associated with any treatment? We want people to receive their treatments. We want them to fulfill their wishes and their ambitions. But we want to make sure they're informed of choices and know exactly what questions to ask when they seek to identify a practitioner. For example, where were you trained? Do you have training to the right level? Do you have any supervision? Do you have support? And who prescribes for you? Who undertakes an inspection of your premises? Do they meet the standard? So there are many questions here. Do you know why would individuals join a voluntary register? What's in it for them? Well, there is quite a lot in it for them about their commitment, demonstration of their commitment to the public and to safety. It will improve, I think, their commercial opportunity as well. The JCCP has been really pleased to work with Transform. Transform is our first major clinic chain that we've signed up to work with. And why we've done that is because we both share a commitment to patient safety. So we're delighted to be working with Transform as a commitment to demonstration of a shared commitment to patient safety and public protection.